The Body Shop with Meredith McDonough and Dr. Steve is brought to you by Allegheny Chesapeake Physical Therapy.
Good evening and welcome to this week's edition of The Body Shop with Dr. Steve. I'm Meredith McDonough. Tonight we're talking about total hip replacements. Dr. Steve, tell us what leads to this.
In most cases, what leads to a total hip replacement is two things. One is that you have osteoarthritis, wearing out of the hip joint. It gets to the point where you need a replacement, and or for the elderly, typically they have a fracture of the hip, a fall, and that's what leads to the surgery and hip and a replacement.
Can you tell us maybe a little bit about the procedure, what actually happens during a hip replacement?
Well, the replacement word is good. It's basically taking the top of the hip joint out, removing it, and replacing it with an artificial one. That's the procedure.
It sounds painful, is it?
It actually is painful. You can expect about 2 weeks of pain after the procedure. However, immediately after the procedure, you're up and moving. You're doing exercise, you're walking, but for 2 weeks you're going to be uncomfortable. Yeah.
All right. Well, Dr. Steve, what about the hospital stay or rehab? How long are you looking at that?
Typically, if everything goes well, you're going to have a surgery. You're going to be in the hospital itself for about 3 to 5 days. Following that is dependent on how good a shape you're in when you went into the hospital. There's oftentimes a rehab stay after that. You need to exercise. You need to do exercises, walking, those kinds of things, in order to make the procedure successful. The hip joint relieves the pain, but then your ability to function and get back to things you need is based on an exercise program. The best approach is to be prepared before you go into surgery. And if you're prepared, then you're going to have a better result. You can actually avoid that rehab stay if, the evidence tells us anyway, that if you have an exercise program 6 weeks prior to going in to have a total hip replacement, if you do an exercise program that strengthens the hip musculature and the quadriceps musculature, which is that upper thigh leg muscle, you actually can perform better, you have a better result, less pain after surgery, and you can be discharged to home.
Okay.
So it's a little bit better response.
So the big thing is make sure you're prepared too before you go into surgery.
Right.
And that makes it a little easier on you.
Absolutely. And one of the other preparations that people can do and prepare for is to have their home evaluated by a therapist. If you get your home evaluated by a therapist, they can look at things like, do you have throw rugs? Throw rugs are dangerous. One thing you don't want to do is have a hip replaced, go home, slip on a throw rug, and then injure your surgery.
Back in the hospital.
Absolutely, back in the hospital. So it's not a good idea there. But you can have your home, grab bars, raised toilet seats, those kinds of things, throw rugs, clutter, get it out of the way, have it evaluated by a therapist before you go to surgery, and then that helps you transition to home a little bit faster. And it may avoid that rehabilitation stay that could be after that 3 to 5 days, going for a couple of weeks of rehab. You may actually be discharged to home.
So thank you very much, Dr. Steve. Very informative, as always. Know everything about a total hip replacement now? If you have any questions for Dr. Steve, just give him a call at 1-800-NEW-SELF or log on to www.AlleghenyChesapeake.com.